Hi, my name is Carolina, and I'll be presenting on the Erector Spinae group. So what exactly is the Erector Spinae? It's actually a group of muscles made up of the iliocostalis, the longissimus muscle, and the spinalis muscle. As you can see on the picture here, it runs on the posterior side of the body from lateral to medial along both sides of the spine. Okay, so we'll start from the lateral out from the outside in. The iliocostalis, as its name suggests, it runs from the ilium all the way to the costals, which is better known as the ribs. But more specifically, it originates from the medial iliac crest, the thoracolumbar aponeurosis, which is found in the sacrum, the posterior surface of the ribs 3 through 12, as you can see right here. And it inserts into the posterior surface of the ribs 1 through 12 and the transverse processes of vertebrae C4 through C7. Next, we'll see the longissimus muscle. That one, as its name also suggests, is one of the longest of the three erectors, because that one runs from the sacrum basically all the way to behind the ear right here. For a more specific origin, again, it originates from the medial iliac crest, the thoracolumbar aponeurosis, which again is found in the sacrum, the transverse processes of L1 through L5, T1 through T5, and the articular processes of C5 through C7. The articular processes, if you're not familiar with those, they're on the lateral side where the two vertebrae meet. They're also known as the zygapophyseal joints or CPOP joints, and or the facet joints. Okay, and then now it's for the insertion. It's the spinous processes of C2 through C6, transverse processes of T1 through T12, and the lower 9 ribs up to the mastoid process, which again, like I said, is right behind the ear. You can go ahead and easily palpate that. It's like that sticky outy bit right behind that ear. And last but not least, we have the spinalis muscle. That one, again, the names are very obvious. It runs along the spine. It originates from the ligamentum nuchae, the spinous processes of C7, T11 through T12, and L1 through L2. And it inserts into the spinous processes of C2, T5 through T12, and the occipital bone. So that one runs all the way to the base of the skull, which is right here. Okay, so what does the Erector Spinae group do? By itself, each muscle, it acts unilaterally, which means it's on one side of the spine. When that activates, it helps you laterally flex to the same side. I'll be showing some videos to show you what it looks like. And then bilaterally, it extends the spine. Okay, one of its main functions is to help us keep our posture while standing and walking. One of the things I've learned is to remember the mnemonic, I like to stand. It basically kind of tells you what its function is, and it kind of, each of the first letters, like I have here, stand for one of the muscles, and it's actually listed from lateral to medial as well. So the I in I like to stand is for iliocostalis, the like is for longissimus, and the stand is for spinalis. Okay, so here I have the extension. And here is lateral flexion. Okay, one more time. This is extension. And this is lateral flexion. Okay, so for strengthening this muscle, It usually requires a lot of pulling motion, especially because we are doing that extension. So deadlifts is always a really good exercise to do to strengthen that muscle. So to perform a deadlift, the subject needs to bend over a barbell while they keep their spine straight, using their straight arms and legs to pick up the barbell back to a standing position. I also have a video for that to show you guys in case you guys don't know what that is. And a quick regression to if someone can't pull up the weight that they have or they don't have the full flexibility yet. I found that rack pulls are very good for that, or having that weight on an elevated surface so that they can still perform that static contraction of the erectors. But they're kind of more focused on that than the weight that they're pulling. A little progression for those that are more advanced is to add resistance bands to the end of the barbells, or you can add those like weighted chains at the ends as well, because that helps you. It provides a way to engage the erectors a little bit more, that you're stabilizing your spine, and it makes it a little harder. Okay, so here's what a deadlifts look like. It's going to show you like an anterior view, a posterior view, and then a good view of the erectors working. Okay, and then the second strengthening exercise that I found was back extensions. I'll show you in a bit what that looks like. But usually that's done in a prone position or in a face down position. You start from a slight flexion, and you use all the erector muscles to pull your trunk up, and you stop once your flat back is achieved. You never want to hyperextend, and you don't want to be using momentum to bring you up, because you can injure yourself that way. Okay, so one of the regressions that I found for someone that does not have the strength to do that from from the machine that I'll be showing you, you can go ahead and go on the floor, and you'll be using like a Superman type of exercise to lift yourself up off your trunk off the floor. And that one you will be in a way hyperextending, because you can't start from a slightly flexed position. You'll just start flat, and then you'll kind of try to bring your trunk up to engage those erector muscles. Okay, and then for a progression, I would recommend adding a weight uh, with a dumbbell by holding it close to your chest, or with a plate by hugging it. Okay, and then that will help definitely with the strengthening for that. Okay, let me show you the video real quick. So here's a video of what a back extension looks like. One more time. So she's starting from a slightly flexed position, and she's going up and then stopping when she has a flat back. Okay, so now for stretching. In order to stretch any muscle, you have to do the opposite of its action. So since one of the actions of the erector spinae is extension, the way we stretch it would be to get into a maximal hyperflexion of the spine. Okay, so one of the good ones that I found was a camel type stretch. I'll show you a video of that in a bit. You're basically on all fours. You're pushing your spine towards the ceiling while tucking your chin in. So it's going to create a good arch of your back. And then once you're done stretching, you'll return to neutral. One of the modifications is you can't be on your knees for too long, or you have some type of pain at the knees. You can always put padding underneath, and you can always increase or decrease the time that you're doing the stretch, um, as far as how it fits into your fitness. Okay, so here she's going to go into that flex, hyperflex position. As you can tell, she has a really good arch right here, and that's stretching all those erector spinae muscles she has. And she has to make sure that she does have her chin tucked in to make sure that that does stretch out those cervical erectors right here as well. Okay, another one of the stretches that I found was a seated child's pose. That one can be done anywhere you find yourself sitting or you feel your back start to ache. You just let the trunk of your body fall in the wide stance between your legs. Also, make sure you're always tucking in your chin whenever you're doing these exercises. That is the key to getting that full hyper flexion of the trunk. Okay, and if that one, I'll show you in a bit and I'll talk about the modifications alongside with it, just because it is a little bit better to visually see what I'm talking about when I add the modifications. Okay, so here, like I said, she has like a wide stance between her legs, and she actually puts her hands alongside the floor to kind of brace her so she doesn't go too far into it. So like one of the modifications would be if you really can't get into this really low hyperflexion, you can grab one of these little stools that they have back there to brace yourself, or put something where you can have your range of motion come into play until you get that flexibility that you want, and then you can start going deeper and deeper into it. And again, another modifier would be the time that you spend in this stretch. Okay, so now we're talking about some of the common injuries for this muscle. Um, just to put this out there, injuries can occur when the muscles are weak or incorrectly used. Anything can really cause an injury. There's not a specific thing that can cause injuries, at least for this muscle group. So this is just a little list that I put together of things that I've seen so far. Usually a lot of the injuries that I receive are dealing with pain mostly. Those are really caused and perpetuated by sitting slouched for too long, sitting in general for too long, um, poor posture throughout the day. That's when they're sitting, when they're driving, when they're on the computer, when you're on your phone. Poor posture throughout the day is going to definitely cause you pain along your erectors. I've also seen misalignment in the pelvic bones, especially if it's one smaller than the other, or they're just slightly off. It's going to cause that imbalance in the tilting, and one's going to be a little bit more contracted than the other. Or even in the spine, there's a lot of spinal attachments, and if something's a little bit off, it's going to throw everything off. Also, I've seen inactive glute muscles because that causes either anterior or posterior pelvic tilt, and then that's going to cause discomfort, and you're going to start walking weird, and then it just keeps going, and you're going to get pain all along the back. I've also seen a lot of people that start lifting too heavy for what they can lift, just because they want to ego lift, and then that causes pain along the erectors. And also incorrect form while lifting causes most of the injuries that I see along those muscles. All of those can actually lead to strains in that muscle group. And then another thing that I've seen is usually direct trauma, usually by car accidents or sporting injuries that they have on the field. Okay, and then that wraps up my presentation on the erector spinae. Thank you.